Did you know that individuals with intellectual disabilities are more sensitive to medication and that they are experiencing adverse effects at a higher rate compared to us? As a PhD student, I'm on a mission to enhance medication use for this group of population. And starting from this side of the slides, my studies are nested within the Intellectual Disability Supplement to the Irish Longitudinal Study on Aging, which is the first longitudinal study in the world that included people with intellectual disability. Despite being at a higher risk to experience adverse effects, people with intellectual disability are considered among the most medicated groups in society, and that they are exposed to excessive polypharmacy, which means being on 10 or more medications with a rate 6 times higher compared to the general population, and that they are highly exposed to certain types of medicine that have something known as anticholinergic adverse effects. These medications are widely used to control medical health conditions, including mental disease, neurological disease, gastric, allergy, and so on. The cumulative use of this medication is identified as anticholinergic burden, which measured through scales that quantify it based on the number and the type of medication taken by the patient. The higher anticholinergic burden, the higher adverse effects, including decline in cognitive function, decline in physical function, higher mortality rate, chronic constipation, and higher risk of falls. My studies examined data provided by around 500 participants participated at 2 time points with 10 years apart. And the study finds that 7 out of the 10 participants are exposed to anticholinergic, and 70% of them continue to be exposed for the 10 years. The study also finds that this long-term exposure was associated with the higher risk to develop mental health condition and higher risk of falls. The study also highlights the urgent need to review medication, specifically those used for psychiatric condition, as they were the most class of medication contributed to this high exposure. By reviewing the use of these medication, we could ensure safer and more effective medicine use. We could enhance the well-being and quality of life for individuals with intellectual disabilities, their families, and their carer. Thank you.